Hello, I am Maria Shinamei Kakontoy from Bachelor of Science in Nursing, Level 3, Section F. My topic is atelectasis. Atelectasis is a medical condition characterized by the partial or complete collapse of the lung tissue, bleeding or reduced or absent gas exchange. This essentially means that tiny air sacs in the lungs, called alveoli, are deflated or filled with fluid, preventing oxygen from reaching the bloodstream. Loss of lung volume caused by inadequate expansion of the airspace results in shunting of inadequately oxygenated blood from pulmonary arteries into veins, thus giving rise to a ventilation-perfusion imbalance and hypoxia. Inadequate expansion of the airspace refers to the inability of the alveoli to fully inflate. This can happen due to the various reasons including obstruction, compression, surface tension. Obstruction, a blockage in the airway such as a tumor, mucus plug, or foreign object, can prevent air from reaching the alveoli. Compression, pressure from the outside of the lung such as from tumor, fluid buildup, or collapsed chest wall, can compress the lung tissue and prevent expansion. Surface tension, the surface tension is normally overcome by the surfactant, a substance produced by the lungs. However, in some cases, surfactant production may be insufficient, leading to atelectasis. There are three types of atelectasis: resorption atelectasis, compression atelectasis, and contraction atelectasis. Resorption atelectasis, airways obstruction, causes the loss of pre-existing air in the peripheral alveoli, leading to the alveolar collapse. Occur when an obstruction prevents air from reaching distal airways. Since the lung volume is diminished, mediastinum shift toward the atelectatic lung. Resorption atelectasis, airway obstruction, disrupts from the normal flow of air into the lungs, leading to the absorption of existing air from the alveoli and ultimately causing them to the collapse. And compression atelectasis, collapse of small airways and alveoli deep to the pleura that occurs when air or fluid in the pleural cavity is under increased pressure. It results whenever significant volumes of fluid, transudate, exudates of blood, tumor, or air pneumothorax accumulate within the pleural cavity. Transudate is a non-inflammatory fluid caused by pressure imbalances, while exudate is an inflammatory fluid caused by infection, injury, or cancer. And exudates of blood are a specific type of exudate containing a significant amount of blood. And contraction atelectasis occurs when focal or generalized pulmonary or pleural fibrosis prevents full lung expansion. Except in cases caused by contraction, atelectasis is a reversible disorder. Atelectasis can be classified into main categories: acute atelectasis and chronic atelectasis. Acute atelectasis is a sudden collapse of lung tissue that typically occurs when a short period, often as complication of surgery or other medical procedures. And chronic atelectasis is a persistent collapse of lung tissue that occurs when a longer period, often due to the underlying lung disease or scarring. The causes of atelectasis are blockage of air passages, bronchial asthma, surgery, diminished respiratory movement resulting from post-operative pain, anesthesia, foreign body aspiration, bronchiectasis, chronic bronchitis, intrabronchial tumor, mucus plug, lung scarring, or fibrosis. And the laboratory and diagnostic: computed tomography, chest x-ray, chest ultrasound, bronchoscopy, arterial blood gas, physical examination, and pulmonary function test. The pathophysiology of atelectasis, we have the modifiable and non-modifiable. So modifiable, smoking, post-operative state, air pollution, respiratory infection, and immobility. So non-modifiable are age, underlying lung disease, neuromuscular condition, and genetic predisposition. Okay, so atelectasis, partial or complete collapse of the lungs, occurs when one or more parts of the lung fail to inflate properly, leading to a partial or complete collapse of the affected area. This collapse specifically affects the small air sacs in the lung called alveoli, which are responsible for exchanging oxygen and carbon dioxide during respiration, resulting in impaired gas exchange and respiratory function. And alveoli deflate. Alveoli are tiny air sacs in the lungs responsible for gas exchange, where oxygen enters the bloodstream and carbon dioxide is released. When these alveoli deflate, it means the collapse and loss their normal shape, leading to a decrease in their ability to function properly. And then excessive secretion or mucus plugs may also cause obstruction of airflow. And complications, pneumonia mucus can cause infection in lung. And the signs and symptoms are shortness of breath, chest pain, cough, increased heart rate, wheezing, tachypnea, fever, excessive mucus or sputum. And treatment, deep breathing, removing destruction in your lungs, inhaled medication to open up your airways. So the medical management of atelectasis are promoting lung expansion, which is deep breathing, medications, bronchodilators and mucolytics, supportive care, oxygen therapy, and pain management. And the surgical management of atelectasis. Atelectasis, the collapse of lung tissue, is primarily managed with non-surgical interventions. Surgical intervention is some necessary to address the underlying cause of the collapse, particularly when conservative measures are ineffective. And the pharmacological management, we have the mucolytic agents and bronchodilators. In mucolytic agents, we have the Dorna alpha, pulmozyme. This deoxyribonucleic enzyme selectively breaks down DNA in airway secretions, reducing mucus viscosity. It has been shown to improve symptoms of atelectasis in children with infectious origins. And we have the N-acetylcysteine, the mucomyst. This mucolytic agent helps breaks down disulfide bonds in mucoproteins, reducing mucus viscosity and promoting expectorations. And in bronchodilators, we have the albuterol, Proventil, or Ventolin. This beta-2 agonist relaxes bronchial smooth muscles by acting on beta-2 receptors. It is typically prescribed on a as-needed basis. The nursing management of atelectasis, focusing on the essential elements of assessment, nursing diagnosis, intervention, and evaluation. The prognosis, untreated atelectasis can result in lung infections, including recurrent pneumonia, and atelectasis may result in impaired oxygen exchange, causing hypoxemia and respiratory distress. With time, recurrent instances of atelectasis may result in formation of lung scarring or fibrosis and decrease overall reserve. Early detection and appropriate management are crucial to prevent this potentially serious complication. That's all, and thank you.